Namaste friends. Today we'll discuss regarding pranayama, how to keep your fingers during pranayama like Nadisudhi Pranayama. So first I'll show you some of the wrong techniques, then I'll also show you the right techniques. So I'll have to start from the meaning of the word pranayama. Prana in our terminology means breath and ayama means prolonged or elongated. So elongated breathing or prolonged breathing is called pranayama. That's the right meaning. Now when you do Nadisudhi Pranayama, you breathe in through the nose. So let's say we breathe in from the right nose first. So I'll close the left nose and I breathe in, I pull the breath. Now you can notice that there is a duration of inhalation, like maybe about 4 or 5 seconds. Now that's a normal inhale that goes in from one nose. Now that is a beginner level practice. Now prolonged breathing can happen only when that inhale is prolonged, and how to do that is done by the right holding of the fingers. So for example, when I keep the finger and I'm inhaling from the right nose. So as I did just a little while back, that's a inhale. Now if I want to prolong that, I can constrict this passage by pressing the finger little on the nasal aperture from the outside. You would have noticed that the length of inhalation has increased. Now how that happened is just because I had constricted the inhalation passage, the nostril, so that the inhale is delayed. The same way when I exhale from the other side, I'll just turn and see, you can see I press this finger, the ring finger on the other side. So when I exhale, I don't exhale in one shot. I delay the exhalation so that the emptying of the air happens slowly. So I'll just take an in-breath normal one. Now exhaling from the other nose, just observe. So you can see the length of inhalation and exhalation, how it increases with the constriction of the passage. So that is how you have to practice Nadisudhi Pranayama. Now I'll show you how to keep the fingers while doing that Nadisudhi Pranayama. So always, many of the people keep the fingers straight. Like they keep it just on the side of the nose and the fingers are straight. When you keep the fingers straight, you will not get the reference for constricting the nostril while doing the pranayama. So because the reference point is on the nasal bone where the nose ends, so you have to keep the fingers on that point. Therefore you have to curl your fingers like a circle. You have to curl it inward, like how the crab biting, like that. You have to curl it inward and use the tip of the finger. Both the tip should be used to keep it on the bone. You can see how I curl the fingers now. So it should not be kept straight like this. It has to be curled. And the nasal bone, which is the reference point, has to be used while breathing. So you get to press on that bone so that the aperture is measured with those fingers. So I can take the reference point as the bone and adjust the hold. So if I feel that the breath has to be delayed further, so I decrease the distance from the bone till the finger so that the aperture is smaller. And therefore while doing this pranayama, the sound will come from the nose. It should not come from the throat, like when you're doing ujjayi breath and all. Okay. So as I mentioned, the two important things of Nadisudhi Pranayama is how to hold the fingers. You have to curl the fingers inward, use the edge of the finger, not the inner side. You have to keep the tip of the finger. The second is, don't remove the finger while inhaling, like Yes, it's an inhale, but it's not a long inhale. It's not prolonged inhalation. So to prolong the inhalation, you have to constrict that passage using the finger. So digitally you have to control. You would have seen how the length of inhalation and exhalation increases when you keep the fingers properly. So this is the way to keep your fingers in Nadisudhi Pranayama. Namaste.